A very good morning to all of you. I am sexologist and sex coach Dr. Uttam Dave, and I welcome all of you to Sex Problems and Solutions video series. Uh, our topic of discussion today is cancer and sex problems. We've all heard of the disease called cancer, and it is one of the toughest diseases to fight for anyone under the sun. Now, if you are suffering from cancer and you have led an active sex life before cancer, you definitely want to continue having sex while you're being treated, or you're being uh, under the process of being examined, etc., etc. So what if you develop sex problems during cancer? So what are the things that are likely to happen? The first thing is that there will be physiological effects of the disease. There is sometimes you may feel tired, sometimes you may not want to do anything, and things like that. Second thing is, once you undergo some form of treatment like chemotherapy, that brings about a lot of weakness, and also your immune system goes down. So that will also lead to some kind of sexual problems. Then you might have to undergo some kind of surgery. And of course, once you've undergone some kind of surgery, even the thought of sex will not come to your mind, because the pain of surgery itself, even after recovery, uh, takes quite some time to go away. So during that time, of course, you will not even be thinking about sex. Again, when you've been diagnosed with cancer, many patients go into depression. Now, again, depression will lead to a sexual problem, uh, in the sense that you will not feel like having sex. And finally, many patients who come to know that they have cancer uh, lead a very stressful life, because they do not know what's going to happen next. Even stress is something which will cause sexual problems in your life. Now, how do you handle all these problems? So once you are suffering from cancer, you would be definitely working under an oncologist. So without any hesitation, if you are somebody who is very sexually active and want to continue with your sex life, you should ask all these questions to your oncologist and ask him for suggestions as to how you could continue with your sex life. Thank you.